MEC of Finance and Economic Development, Lebogang Maile, has briefed the media on the state of the finances of the Gauteng Provincial Government and the 2024-2025 Provincial Audit Outcomes. The MEC used the briefing to outline GPG's cash position, revenue performance and expenditure, as well as discussing the complexities of managing provincial finances in the current economic and fiscal environment. The MEC also discussed the Provincial Audit Outcomes for 2024 and 2025 financial year and outlined interventions to strengthen governance and financial management in the province. Well, for more on this, we cross live to our reporter, Mbalenhle Mthethwa. A very good afternoon, Mbalenhle. Just tell us more.
Good afternoon, Nompu. Yes, indeed, the MEC has outlined those audit outcomes, and he explained that 14 departments were under review by the Auditor General, as well as 19 enterprises that fall under the Department of, the Provincial Government's leadership and stewardship. And in those outcomes, it seems as though 14 departments, out of the 14 departments, 7 departments have received a clean audit, including the Office of the Premier, eGov, and Treasury, as well as Education. But it would seem as though more still needs to be done to assist the Department of Health. It seems as though they have really performed quite poorly, according to the Auditor General's report and what was outlined by the MEC of Finance, who joins me now. We're just going to ask him first about the performance, the health department's performance, and the failure to meet certain requirements that were set out by the Auditor General. Talk to us about those at length and just give us what exactly happened within that department.
Thank you very much. And in fact, I think it's important to explain that in Gauteng, though there's 7 departments that got clean audits, but there is no department that has got an unqualified. That has got a qualified audit, meaning everything's it's looking good, we're doing well. And of course, there are opinions that have been expressed by the Auditor General, including on the Department of Health and the other 7 departments. So I think that's what is important. It's not like the Department of Health has done badly, but we are concerned about the Department of Health because a lot of challenges are pointing to the department in terms of finances, the payment of invoices within 30 days, the accruals, litigations that are sitting at about just over 18 billion just in health alone. So we are worried about the department, and we are doing everything in our power, working with the department to ensure that we sort things out. But they are not the only department that we're worried about. We also have other concerns, especially in infrastructure in terms of our spend. We're not doing that well, and we would like to improve and ensure that we fast-track the pace of spending.
Now, yes, we do understand that, the health department is not the only department that has seemingly received an adverse opinion despite receiving a qualified audit. But it would seem as though it has faced a few challenges, including overspending and so on. And you have taken a hard stance to try and assist with regards to supply chain management in that department, as well as ensuring that you strengthen the checks and balances in the department to ensure that all these challenges are resolved. Particularly given the fact that the Department of Health has been in the media for all the wrong reasons, including the procurement of genes for 500,000 rand. Talk to us about that.
Well, let me emphasize, the department has received an unqualified audit, which is a good opinion. So it's not like they're not doing well. Of course, they've got huge pressures. Education and health, human settlement, for instance, they face a huge strain because Gauteng receives at least 230,000 people every year. Department of Education has at least 50,000 more kids every year. When people come to the province and they get sick, they go to our health facilities and all that. So Department of Health is bound to have problems because of the huge numbers that we're receiving. The Department of Human Settlement, Department of Education, just to count a few amongst others. So it's not surprising that we've got problems there. The issue is how do we manage them and whether we understand those problems. And I think where we are, we think we have a better sense and understanding of what are the issues. And one of the issues, by the way, for health nationally, not just in Gauteng alone, is the baseline. There is not enough money available to finance health. So that's one of the objective reality we're dealing with. But there are other subjective issues that have to do with how they manage their resources, the wastages, being overcharged in certain instances, and then people not doing what they're supposed to do and all that. So there's both objective and subjective factors. So we shouldn't create an impression that it's only subjective factors that are affecting the health budget.
No problem. Thank you for correcting me. It is an unqualified audit finding and not a qualified audit finding. Now, the Gauteng province is the country's economic hub, particularly the city of Johannesburg. And this is where everyone comes to try and find economic opportunities. And what are you therefore doing as the provincial government to ensure that Gauteng maintains this position and you are able to then enhance your revenue collection measures to ensure that you are able to better fund departments such as the health department as well as others?
Well, as I've explained in the press conference, there's about three sources of funding. Firstly, it's the equitable share, which is given to all provinces and municipalities and based on a set criteria. Secondly, it's the conditional grants, which are meant for specific conditions. And then thirdly, it's our own revenue. On the own revenue, in the last 5 years, we have raised about 36.8 billion. And we think we will be able to raise far much more now because we are deliberately focusing on that. And as I've said, because there are a lot of pressures, for instance, on Monday, we're supposed to pay our first installment towards the e-tolls. Remember, the citizens have refused to pay now. The government has to pay. So we are going to spend about 20 billion, 12 billion on the actual debt, 4 billion on the interest, another 4 billion on the maintenance. So we're paying the first installment on Monday, about 3 billion rand, and that will put a huge strain and pressures on our provincial resources. The challenges in health, challenges in education, and the fact that about 15 billion of our budget has been cut is putting a huge strain as well. So we have a lot of pressure, but we're working hard and doing a lot more to raise more resources so that we're able to keep up with the challenges and the pressures that arise on a time-to-time.
Thank you so much for speaking to us. There you have it. That is MEC for Finance in Gauteng, speaking to us about the state of the province's finances. And he's also taken a hard stance going forward, saying that they will be ensuring that there is consequence management and they will not be adding more money when they do consider those budget allocations or reallocations later on in the year. If issues such as supply management regulations and others are not then resolved, he will be entering into meetings with some departments which performed quite poorly according to the Auditor General and which underspent or overspent over the year. And these conversations will be beginning next week, and we hope to hear more about that. For now, it is back to you in studio.
Thanks very much. My colleague there, Mbalenhle Mthethwa.